A 15 years old boy present to the outpatient clinic with tiredness, recurrent throat and chest infection, gradual loss of the vision, and multiple X-ray shows brittle bone with no differentiation between the cortex and the medulla. What is the most likely diagnosis? Here the options. Options are the rickets, osteomalacia, osteopetrosis, Ehlers-Danlos syndrome type 2, osteogenesis imperfecta. So what may be the answer? Actually, the answer located with this bone, which is this option, which is the brittle bone syndrome, and there is no differentiation between the cortex and medulla. So let's see first of all the osteopetrosis. The osteopetrosis, it is a rare, hereditary and familial bone abnormality, and it is characterized by lack of reabsorption of the normal primitive osteochondrous tissue. Persistence of the tissue inhibits the formation of the normal mature adult bone with medullary canal containing the marrow tissue. So the osteopetrosis, it is hereditary and familial bone disease. And let's see the osteopetrosis. Its bone becomes harder and more dense. So first option, in case of the osteopetrosis, that bones become more hard and more dense. It is autosomal recessive condition. It is commonest in young adult. Radiology reveals there is lack of differentiation between the cortex and medulla. That means there is no differentiation between the cortex and medulla, and it is also known as the Marvel bone. So what is our answer? Our answer is the osteopetrosis. Why osteopetrosis? Because here we can see there is the first point is the brittle point. Second option, there is no differentiation between the cortex and medulla. So this one point, brittle bones, this one is enough for diagnosis of the osteopetrosis. And second one important is there is no differentiation between the cortex and medulla. And the clinical feature, here we can see the recurrent throat and chest infection, and there is gradual loss of the vision and also tiredness. That means they reduce the normal defense system of the body.